or inhibitor, I'm guessing that's probably sirolimus,
That's right.
had shown some promise. And then in that process, you developed a way to study rare conditions that could be generalizable beyond Castleman to, we'll get to COVID in a couple of sentences here, but tell us about that process. How did you come upon that? What spurred that thinking? How does that work for people that aren't yet familiar with your book and your work? Tell us about that.
Sure. So, as we just talked about, I'd gotten through these three flares of the disease. Chemotherapy saved my life, and I was put on an experimental drug that I thought would, and I hoped would keep me in remission, a drug called cetuximab. And I went back to medical school, back to my old plan of becoming an oncologist. And I really hoped that, I've dodged this bullet three times. I'm on
Yeah.
this experimental drug.
Jeez.
Can I get back to my old life and my old mission? And then about a year later, I had my fourth deadly flare of the disease.